Hey, Chris.
Hey Jeff, how you doing today?
Good, my friend. How you doing, buddy?
Doing well. Appreciate you hopping on with us tonight.
Absolutely. Let me get where's my video? Oh, there it is. Start video. You cannot start your video because the host has stopped it. Okay.
That's that's strange, but at least here I'll make you a co-host and let's make sure that that works.
Okay, yeah, let's do that. Yep, there we are.
Awesome, man. Cool.
My light's so bad.
Awesome. Good. We have three people in so far. I'll let them in a minute. Or they're
Okay.
already in. Sorry, already in.
How many people are we expecting?
We didn't get any RSVP, like we didn't ask for an RSVP or anything like that. So usually, we generally have had somewhere north of 20. Sometimes,
Okay.
depending on the topic, we've had up to 50, but it sort of depends. But right now, I have three with us.
Okay.
Yep. And then everything, if it's okay with you, we usually record it and make it into a Zoom video for them if they miss the presentation tonight.
Perfect. Yep, that's perfectly fine.
Awesome, man. And I have Dawn with me.
Am I on there?
Not yet.
Oh, how do I get on if I should?
Thank you.
Mark,
Yes,
still mad at you. You missed the Penn State game.
indeed I did. I didn't miss it. I purposely chose not to go out in the shitty weather and watched it at home.
To be honest, I hung out with Jim for a while. To be honest
Yeah.
with you, the weather held out. We were good the whole time, basically.
Yeah, but once you have a couple beers, you get settled in, like you're on your couch, you're looking outside, it's like cold and miserable. I'm like,
Yeah.
you know what? I'm just gonna hang here. I'm old.
No,
How
I
you
get
doing,
you.
Mark?
Hey, Chris.
Hey, so just I don't care, but I want you to know all the clients are pouring in here. We got 5 attendees with us.
Oh, nice. Pouring in.
They're
Yeah, Jeff,
pouring-
Jim said he had a great time with seeing you and that was, it was a lot of fun.
Yeah, the game was great. Obviously, they won big, and yeah, it was really nice to finally. I've known Jim for 5 or 6 years, and I never met him. So, oh, Jesus! Actually,
That's great.
I gotta fix that. Why is that automatically?
If you look in the settings, there could be
Yeah, let me. I'm just gonna delete the.
right there, right at the top, it says use timings. If you click that off, it should help you.
Okay. Oh, nice. Okay.
Yeah, and
So I had some
there's also narrations on, it says. I don't know if you need those on or not.
No play narrate. Oh, excellent. Okay, I didn't know that.
Gotcha.
I'm just gonna delete these. These are like old
Yep.
narrations I used to do.
Yeah, I think now that you turned them off, it shouldn't turn on. Should be good. So let's see. I know there's some more folks joining. I'm gonna see I'm gonna turn things over in a couple of minutes to you, Jeff. Let's just give folks a couple more minutes.
Yeah, take your time. Literally no rush. So
okay, sounds good.
I'll be right back too. I'm gonna check on Jim, make sure he can get on.
Okay,
he can get on.
perfect. Hello, everyone. Thanks for joining. We're going to give everybody a couple more minutes to join today, and then we will turn things over to Jeff.
How we doing, Mr. Sadowski?
Doing well. How you doing, Chris? Good. We've put folks coming in. We're gonna kick off in a couple of minutes. I'm gonna allow a couple more minutes for folks.
Sounds good.
Thank you.
Well, Jeff, thank you for lending us your time.
Absolutely, Chris. Anytime. It's my pleasure.
Thank you.
Hey Jim, how you doing? I promoted you to a panelist, so now you can speak as well.
Jim's muted.
How about now?
There you go. Jim, I have a concern here. I noted that Sadowski purposely did not allow you or I to turn our cameras on. I mean, I'm taking that a little personal.
Next week.
Yeah, sorry. Here, let me see. I can.
No, really, that's okay. I'm good.
Yeah, nobody wants to see your ugly mug anyway, Mark. All right. Well, it's 6:03. I know we still have some people coming in, but for now, I have everything recorded. So if you don't see anything or you have any questions, we'll certainly send you out the recording. Want to start by welcoming everyone tonight to our quarterly town hall. I know that we've been trying to keep these. This is our fourth one. We've been keeping them on schedule. So the first thing I want to do is just go ahead and introduce the folks that we do have with us here tonight. We have Chris Shipsky, who is the owner and the head chief of the Athlon Columbia office. Thanks for being here, Chris. Then we have Jim Fay, who is running the State College Athlon office, and as you know, joined as a part of Athlon the last few years. I know some of the folks up there in State College knew him and Mark before joining Athlon. And then we also have Mark Hood joining here as well with us. So then the final thing that I want to do is I want to go ahead and introduce our guest speaker tonight. We have Jeff Lindgren here with us to talk to you about the wonderful world of Medicare, and I know he's so happy to be here. So turn things over to you, Jeff.
Excellent. Thanks, Chris. I want to thank everyone for joining. I'll tell you a little bit about myself, but first, if you have any questions, please put them in the chat, and I'll make sure to address everyone at the end.
Yes.
Everyone's specific situation is different when it comes to Medicare, so I'm sure you'll have different questions. Please put them in there, and I'll definitely answer every single one of them. I own KJ Consulting. Chris, everyone can see my screen, correct?
Yes, we can. And also,
Okay.
Jeff, to go along with what you said, if they would like, they can also direct the questions at me, and I can keep a list for you as well if that's easier. Either one of us.
Yep. Either way.
Perfect.
Make sure you have any questions. I'll definitely get to. So I own KJ Consulting. We focus specifically in Medicare and group benefits. So we're not. We don't have too many. We don't do homeowners and auto insurance. We really specify in Medicare, in helping people understand the transition process to it as you're turning 65 or as you're retiring. So I really like to keep a niche clientele base and only specifically do Medicare. I'm originally from Massachusetts. I was born and raised there for 26 years. I moved to Charleston, South Carolina about 9 years ago. I've been in this industry for 8 years. We keep up on it, we keep track of it, and we really understand what it takes to help people understand Medicare and to transition to Medicare. As you're turning 65 or you're retiring, you're going to get bombarded with phone calls and emails and people just trying to sell you something. When it comes to our consulting company, you're going to have my specific, you're going to have my literal cell phone number where you can reach me at any time. I'm not trying to just sell you something. I'm trying to be with you for the long run. So we're going to talk at least 2 times a year, especially every October, where we're going to review your Medicare plans. So I'll get into it. Okay. So the first slide is open enrollment period, and we're in this right now. So this is a very important time for people who are on Medicare, not even going on to Medicare, people who are on Medicare right now. October 15th to December 7th is the time where you can change your Medicare Advantage plan or you can change your drug plan. I wrote this right here. When was your last review? I had a client today, actually. His name was Chet. He's 86 years old. He's been on the same drug plan for 20 years. He's been on the same drug plan. In the drug plan, he was paying $90 a month where he didn't have to be paying $90 a month. He could have been on a $5 a month drug plan, but he just never had anyone to help him. So this gentleman was paying $8 a month for the past 20 years where he really didn't have to. So when was the last time you had your Part D drug plan reviewed? And that's something we do here at KJ Consulting. The other thing is Medicare Advantage plan. Every open enrollment period, October 15th to December 7th, you can change your Medicare Advantage plan. Now, it's important because these change every year. These Medicare Advantage plans change. So 2023's plan and 2024's plan could be completely different. So if you want to review your plan, I'll give my contact information at the end. Let's just review it because maybe it's best for you or maybe there's something better for you. When it comes to Medicare supplements, all you guys and ladies who have Medicare supplements, those actually can be changed any point throughout the year. A lot of people don't understand. A lot of people think, oh, I have to change my supplement between October 15th to December 7th. That's actually not true. You can change your supplement at any month or any time in the year, as long as you can pass health questions. And that's something we can review as well. So if you have a Medicare supplement that's really expensive and you're not happy with, we can look at it anytime throughout the year and see if there's something better for you if we can pass health questions. Let's get into just basics of Medicare. There's Part A and there's Part B. Part A is your hospital side. So this is without a supplement or without a Medicare Advantage plan. Here's what you would pay if you had nothing besides Part A and Part B. There's a $1,600 deductible as soon as you walk into the hospital. If you don't have a supplement or a Medicare Advantage plan, every time you step in there, you would pay $1,600 in the hospital. Coinsurance is $400 a day, days 61 through 90. The first 60 days are free. And lifetime reserve days are 60. And then skilled nursing is $200 a day, days 21 through 100. Days 1 through 20 are free for skilled nursing. Part B is your doctor's side. Part A is free. Part B you have to pay for. Next year in 2024, it'll be $174.80. It's $164.90 right now in 2023. For most people, we'll get into IRMA in a little bit. IRMA is if your income is higher, you pay more for Part B, and we'll get into that later. The deductible for Part B is $226 at the doctor's office. So how it works is Medicare pays 80%, and then you're left with 20%. So you'll pay 20% of your bills. Go down for secondary coverages to Medicare. You can do a Medicare supplement and a drug plan, or you can do a Medicare Advantage plan. 2 completely different routes that we'll get into. But here's the first route, which is original Medicare and a supplement. Here are all the supplements available throughout the country. They're all regulated by the government, so they're all exactly the same. A Plan G with United Healthcare and a Plan G with Aetna are exactly the same. It just really depends on the financial strength of the company, the premiums, the customer service, all that good stuff. But they're exactly the same. So don't think if you have a Aetna G plan and your friend has a Humana G plan, they're not different. They're exactly the same. So here are all the plans, A through N. We're not going to get into what each one does specifically. And I will on the next slide, I'll go into my two favorite. But these are called Medicare supplements or Medigap. A lot of people call them Medigap plans. So you might hear that word as well. Here are the two most popular at the time, currently at the time. A G plan and an N plan. Now let's go over exactly what they cover. The G plan is very simple. Remember that Part B deductible we talked about, the $226 once a year? That's your only out-of-pocket cost. Whoop, let's go back. How do you go back? Back. Your only out-of-pocket cost, if you have a G plan as your supplement, is a $226 doctor deductible. You reach that $226 once a year at the doctor's office. After that, everything's covered 100%. It's really good. And in most states, the G plans range between $90 to $150 a month. They're very affordable. This is for a 65-year-old person. They're very affordable. So a G plan is probably some of the best coverage you can get in the country. I mean, if I could only, now I'm 36, if I could pay $100 a month for a $200 deductible, I would take it in a heartbeat. I mean, it's very, very good coverage. The N plan is very similar to the G. You have to meet the 226 once a year at the doctor's office. After that, it's up to a $20 copay per doctor visit. So you meet the 226, and the next time you go into the doctor's office for anything, a specialty visit, any visit you do, could be up to $20. No more than that, however. So the N plan is really nice. My father is down here in South Carolina. He turned 65 2 years ago, and he has an N plan. We thought it was the best financially for him. It made the most sense. But like I said earlier in the presentation, everyone's specific formulary, everyone's specific health profile, financial profile, they're all different. So these might not be the best for you. It's always pertinent to speak to someone who knows what they're talking about, go over everything you have going on, and then make a suggestion from there. But these are just two of the most popular I wanted to show you. Okay, Part D is your drug plan. With a supplement, like we talked about, the two streets. A supplement, if you have a supplement, you have to have a standalone drug plan, a Part D drug plan. Now there's a bunch of them. There's probably 30 drug plans that Medicare offers. And everyone, like we talked about earlier, everyone's situation is different. So what I do is I take all of your prescriptions, the milligrams, the times per day, and I run them through a software system that we have. And I tell you what's your best drug plan for the following year. And these drug plans change every single year. So a lot of people, like the gentleman, my client I was telling you about, he was on the same drug plan for 20 years when he didn't have to be. Every October, with all of my Medicare clients, I go over all of their updated prescriptions, all of the updated drug plans, and we choose the best one. A lot of people don't know that you have to look at your drug plan every year. I'll just keep the same one. It's working. Sometimes the premiums jump $50 a month. Sometimes one of your prescriptions is not covered the following year. You really need to make sure that you're reviewing your drug plan with a professional every single October 15th to December 7th to make sure that you're on the best drug plan for you the following year. A lot of people do not do that, and that's something that we offer at KJ Consulting. A free service. I shouldn't have mentioned that earlier. All of our services are free. It's just advice, professional advice, and we don't charge anything for our services. The donut hole. I know I was talking to Don and Chris earlier, and a lot of people had questions about the donut hole. The donut hole, again, is specific to people's formularies, and it's very different for everybody. A few notes. The Part D deductible is going to be $545 in 2024. It was $505 last year. The deductible, it's not like you have to meet it before your prescriptions are covered. It depends on what tier of drug you have. So again, I highly recommend you setting up a meeting with us so that we can talk about your drugs and see which ones fall into the deductible. How the donut hole works. So if you look at step 2 here, or number 2, after your plan is paid $5,000 in drug coverage, you go into what's called the donut hole. Your drugs become more expensive after that point until you hit 8,000. Not you spending 8,000. The drug plan pays 8,000. You will have to spend that. Once you hit 8,000, all your prescriptions become free. It's called the catastrophic coverage. So it's really hard to give a specific example, but I could show you with your. So for example, if a lot of people take Eliquis or Xarelto, which are very expensive brand name drugs, you'll probably go into the donut hole midway through the year. The Eliquis will become more expensive. Then you'll get out of the donut hole and the Eliquis will become free. But to tell you exactly when you'd be in and out of the donut hole, I'd have to have your specific drug formulary, which I will definitely run for you and look at and check all the best plans. But that's how the donut hole works. It's a little bit scary, but if you're not on specialty high tier drugs, you're probably not going to run into the donut hole. Okay, here's the second street we were talking about. There was the supplement and the drug plan, or you can go to a Medicare Advantage plan. 2 different streets. What it does is it takes part A, your hospital side, like we talked about. It takes part B, which is your doctor side, and it takes part D, which is the drug plan we talked about, and it rolls it all into one. And here, let's make it more confusing. It's called part C. So it makes it even more tricky to understand, but it's called part C, which is a Medicare Advantage plan. How it differs. Most of them are free. So a lot of people like these because they're 0 premium. You can get a Medicare Advantage plan and you don't have to pay for a traditional supplement, which ranges like $100-ish a month. There is, however, a network where you have to stay within a certain hospital and doctor network. Again, I don't think I mentioned this, but the supplements have no network. A Medigap supplement, you can go anywhere that takes Medicare in the country. You don't have to worry about staying within Humana's network or Aetna's network. There's no network. The Medicare Advantage plan, you're locked in for the year. So if we get one now for 2024, you'd have it until 2025. And it's a pay-as-you-go service. How I describe it, if you had employer coverage, say you work for Ford Motor Companies, and you had employer coverage, a Medicare Advantage plan is very similar to an employer coverage, where you have a network and then you have copays as you go. So you pay as you use it. So for example, an ambulance is a $300 copay. An MRI is a $200 copay. This is on some plans, not every plan. Days 1 through 5 in the if you spend 3 days in a hospital bed, days 1 through 5 are $300 a day. So you kind of pay as you use the plan. So for people who are super healthy, they love this because it's 0 premium. They don't have to worry about using it because they're healthy. As soon as they become unhealthy, they sometimes get aggravated with it because you have to, you're going to pay copays as you use the plan. Part C Medicare Advantage plans are good for some people. They're not good for other people. It really depends on your situation. I emphasize this throughout this whole presentation so far. We really have to go over exactly what you have going on. For example, if you had cancer and you're going through a lot of treatments and chemo and you go to the doctors once every 2 weeks, a Medicare Advantage plan is probably not right for you. You probably want to go with the supplement, which has better coverage. But like as I said again, we really have to know what's going on with you. But this is a Medicare Advantage plan. There's 2 different types, an HMO and a PPO. I put this in here because people listening, if you have an HMO, you probably should go to a PPO. Now, if you love Medicare Advantage plans, that's great. Let's stay with the Medicare Advantage plan, but let's change to a PPO. A PPO has out-of-network coverage. So you get reimbursed if you don't stay within the network. The HMO, you are bound to that network. If you go out of network, you are getting 0 coverage. So the HMOs, I really, really try to stay away from. We have a lot of clients on Medicare Advantage plans, but I always direct them to PPOs because you get that out-of-network reimbursement. You don't need a referral fee, as you can see, and it's just better for if you travel. And again, I can't help but emphasize your situation is different than everyone else's. If you stay at home and you never leave your hometown, your kids are there, you don't travel, maybe an HMO is right because sometimes they have better benefits. But if you have kids in different parts of the country and you like to travel, we might want to go to a PPO plan for a Medicare Advantage plan. So if you're in this Zoom and you have an HMO, we should probably look at a PPO because a lot of the times they have just the same amount of coverage. There's zero premium, and you get that out of network benefit, which is really important. Okay, again, the two streets. Here's the differences. I'm not trying to confuse. Hopefully, this really ties everything together we've been talking about. A Medigap or supplement versus a Medicare Advantage plan. The Medigaps, higher premiums but no copays. The Medicare Advantage, generally low premiums but has copays. So you want to pay the monthly premium and have no copays, or do you want to have the zero premium and have copays as you use it? Freedom to choose doctors, the Medigap, no network, amazing. I have a lot of clients who travel all over the country. They live in South Carolina. They have kids in Massachusetts, in Texas. They don't want to worry about a network. So they like the Medigap plan. The Medicare Advantage plan, like we talked about, may be restricted to network. If it's a HMO, it definitely is restricted to network. No referrals on Medigaps. You may have referrals on Medicare Advantage plan. Here's where the Medicare Advantage plan is better. Medigap has no dental, vision, any of that coverage. A lot of the Medicare Advantage plans have that extra benefit. Some of them have free gym memberships, have preventative dental. So you get like a couple cleanings per year for free, which is amazing. And then they also have some vision coverage, which a supplement Medigap does not have. And then again, Medigap is covered anywhere in the US. Also, the Medigap plans have international coverage. So if you're a traveler, you go to Europe, you go anywhere to Italy, that's in Europe, right? You can get coverage internationally. It's really good coverage, actually. So a lot of my clients like, Jeff, I'm traveling. Am I covered with a G plan? Yes, you are. Medicare Advantage plan, you only get emergency services out of network. So God forbid you're visiting someone and you need an emergency surgery, that will be covered, but no routine or any checkups like that will be covered out of network. Okay, IRMA charges for people who are so this is for an individual is 102,500. For a couple is 205,000. This is for 2024. This is based on your 2022 tax return. So if you're under these numbers, you don't have to pay attention anymore. You can take this slide off. But if you're over these numbers, you will be charged more for Part B of Medicare. B as in boy. You will be charged more. Like we talked about earlier, the Part B is $174.80 for 2024. 90% of people pay the $174.80. If you make more than this as an individual or as a couple, you will pay more for your Part B. We have a lot of clients who are in this situation. We have a client, Betsy. She sold her house in 2021. She sold her house and claimed $300,000 for her taxable income. So she was charged more for Part B of Medicare just for that 1 year, but she was still charged more because she claimed that as income. So this is something that we really want to talk about when we meet. If your income is higher than this, or you think maybe you're going to take some investments out, or you're going to take some out of your 401k, let's talk first, because we need to know that Part B and your Part D, which is your drug plan, will cost more if your income is higher than these. And a lot of people don't understand that. And a lot of people, we don't have an agent who talks about this kind of stuff. So if you're in this situation, we need to have a chat so we can talk to your accountant. We'll do a Zoom, including your accountant, and see if we can get your modified adjusted gross income to where it needs to be, so you don't have that you don't have that IRMA upcharge. So that's IRMA, kind of in a nutshell. The Give Back program, I won't talk too much about, but it's this is for specifically for a Medicare Advantage plan, only for a Medicare Advantage plan, and it's only in certain zip codes, and it's only for a certain income of people. If you have a higher income, this won't apply to you. If you have a lower income, you might be able to get some money back with a Medicare Advantage plan. So if you do want to meet with me, you do shoot me an email, and you think you might qualify for this, we'll talk about the Give Back program. and we'll run it through the system and see if you qualify. When to enroll. This is very important. We've had some clients in the past who haven't taken their Part B of Medicare when they were supposed to, and they've gotten a penalty. We need to make sure that you take your Part B of Medicare when you're supposed to. Part A is free. We don't have to worry about Part A. But if you're eligible for Medicare, say, what are we in? October? Say you're eligible for Medicare on November 1st, and you don't have credible work coverage. Say you're not even working or you're retired and you don't sign up for Part B of Medicare. You will be penalized 10% per month of the Part B premium until you sign up for Part B. You need to sign up for Part B when you are supposed to, unless you're still working and you have credible work coverage. That means over 20 people in your company are enrolled in health coverage. If over 20 people enrolled, you can pass off on Part B until you retire. Before that, we need to get Part B or you will be penalized. So if you're coming up on 65 and you call me and say, hey, Jeff, I'm still working, I'll ask you some questions and we'll see if we'll make sure that you're not going to get penalized. If you say, Jeff, I work for a small company, I'm still working, I have group health coverage, and I don't want to take Medicare yet. If there's only 5 people in the company, you have to take Medicare, or you'll be penalized. So everyone's situation is different. The times to enroll, if you're turning 65, 3 months before is the time to start talking to me and talking to a professional so we can get the transition process started. 3 months before you're 65. You also have 3 months after 65 to enroll in Medicare as well without a penalty. So there's 7 months, 3 months before your birthday month and 3 months after. You have 7 months to make a decision about Medicare. So if you're coming up on 60, if you're 63, 64, let's start talking about it. Let's start figuring out when you can get onto Medicare and if you need to get onto Medicare. You might not need to. You might be able to stay on your work coverage. I've had clients who are 72 who've had credible work coverage, and they call me and say, Jeff, I'm about to retire. Let's make this transition. So then I'll help you transition off of your work coverage on the traditional Medicare. What to do next? Here's kind of where I summarize everything. If you need help, this is where I come into play. If you're turning 65 in the next 3 months, that's when you need to reach out to me. If you're collecting Social Security, if say you're 64 and you're collecting Social Security, you will automatically be enrolled in Medicare. There's nothing you need to do. They'll automatically enroll you. Then you call me up and then we'll find a supplement or a Medicare Advantage plan. We'll find the right path for you. But if you're not collecting Social Security, we need to physically, either online or at the Social Security office, we need to enroll in Part B of Medicare to get Medicare benefits rolling. If you're over 65 and retiring soon, that's when you need to reach out to me, or not just me, any agent you trust or whoever it may be. You need to reach out to someone, because once you retire and you lose your benefit, you need to get Medicare right away or you will be penalized. And then the other reason to reach out, if you're unhappy with your current supplement, Medigap, or your Medicare Advantage plan, say, Jeff, this Medicare Advantage plan doesn't work for me. There's no doctors in network. My drugs aren't covered well. That's when you need to reach out to someone. And again, that's December 15th to December 7th, the Medicare Advantage plans and the drug plans. And the last thing I didn't put on here, reach out to me during this time that we're in open enrollment about your drug plan. Maybe you've never had a review. Maybe you've never had someone say, hey, you don't need to be on this plan. This is a way better plan for you. And I send you a report and I show you the best one. Maybe it's the same. Maybe it's completely different. So that's another reason to reach out to someone who knows what they're talking about. So you can just review your drug plan and just make sure you're in the best financial situation. Okay, here's my contact information. If you don't have it, I'm sure it's being recorded. So you can write it down or text me. This is my cell phone number. Text me, call me, email me. And yeah, I'd love to help anyone who needs just any advice. I've had so many people call me and I've said, hey, you're in the best situation possible. You don't need to do anything. Like I'm not here to make $1 million. I'm here to help people and guide them in the right direction. So I'm not going to pressure you into doing anything that's not right for you. Our mantra in our business statement is just help people get into the best situation for them. So here's my information. Chris, I see
Sure.
some questions.
Yep. So you have the Q&A ones, and then I have a few more
Okay.
queued up that I got sent. So I'll let you take the Q&A ones.
Yeah. Okay. The first one, after 65, can you use HSA money to pay for Medicare premiums? It's a great question. I literally didn't know this until about 3 months ago when it came up. You cannot, unfortunately. Your HSA goes away after you go on to Medicare. So if you have the money, spend it now with your current employer or whatever coverage, your high deductible plan you have. You cannot use HSA money for Medicare. Can you open a health savings account if you have a group Medicare Advantage plan? A group Medicare Advantage plan, I am not familiar with at all, Diana. I'd have to speak to you specifically and see exactly what you have. I'm familiar with group Medicare Advantage plans. And this is through PSU, so probably Penn State's Medicare Advantage plan. Okay. So Diana, if you want to email me, we can speak specifically about it, and we can really get into what you currently have. I don't know if it's work coverage. I don't know exactly what it is, but we can definitely get into it. It looks like Medicare Advantage plans are having a much bigger deductible for next year. True across the board. Yes, when it comes to it, health insurance is going to go up every year no matter what. Deductibles, copays, the cost of medical expenses are so high. They're always going to go up. So yes, across the board, the deductible, it's actually not a deductible. They're called copays, but yes, they will be higher. But it's always good to look at what you currently have versus other options that are out there. And I think this is the same, Diana, with the group Medicare Advantage plan through PSU. I'd love to see exactly what that entails, because they might pay for some stuff for you. I don't know. So that's a very specific question we'd have to look into. Chris, what do you have over on that side?
Mark,
Let me just jump in real quick, Jeff.
Yeah.
Just to clarify, agreed, you cannot pay premiums for Medicare out of a HSA. However, the HSA doesn't go away. You still would use that for out-of-pocket expenses and all those kinds of things. So the money that you've been saving, or the client or person has been saving in a health savings account, is still good. You can still use it. You just can't pay premiums with it.
Okay. Yeah. That okay. Maybe I misunderstood the question. Yeah. Her question was pay for premium. Yes, you can't pay for premiums. Some out-of-pocket costs. Yes. If you have that, because it's like a credit card. So you can use it for out-of-pocket costs that Medicare doesn't cover. Yes, correct.
Yeah, exactly.
Good input.
I just didn't want anyone panicking
Yeah.
on that one.
Yep. Okay, so I have 9 here that I've got queued up. So we'll hit you with some rapid fire ones. So
All right, I love it.
I think a couple of these got answered already, but I'll throw them out still. So
Yeah.
Can you just remind us what age is it that someone becomes eligible for Medicare?
65 is the age right now. 3 months before is when you really want to start reaching out to someone, a professional, so you can start thinking about how you're going to transition. But 65, so it's the first. Here's a good little tip. So it's the first. So say I'm August 10th birthday. So I'd be eligible August 1st of my 61st birthday. If you are born on August 1st, it's the month before. It's July 1st.
Huh.
So if you are first of the month birthday, it's the month before. So don't if you're a first of the month birthday, make sure that you keep that 3 months and it's the month before. But it's always the first of the month of your 65th birthday.
Okay, perfect. Then if somebody needed to, how do they go about enrolling in Medicare?
Again, 3 months before, we
Yep.
need to figure out if they're collecting Social Security. If they are collecting Social Security, it's automatic. You don't have to you really don't have to do anything. If they are not collecting Social Security, we can do it online at ssa.gov, which is pretty simple. We do a Zoom and we help them. Or you can fill out some paperwork and walk into the local Social Security office. It'll take you, depending on how long the line is, it'll take you a couple hours. You fill out the paperwork and you'll get Part A and Part B of Medicare.
Okay, so you sort of knocked out another question, but I'll confirm this one. So if you plan to defer your Social Security, are the payments coming direct deposit out of your account then?
So how Part B of Medicare works, if you're not collecting Social Security, they're going to ask for the first 3 months up front.
Okay.
So say I'm an August 1st birthday, August, September, and October, they're going to ask for those. So 174.90 times 3, they're going to ask for that up front. After that first quarter, those first 3 months, you can pay monthly. But if you're not collecting Social Security, know that bill's coming for 3 months up front. And then you can do monthly after that.
Okay, perfect.
If you are collecting, Chris, they'll just take it month by month out of your Social Security check. You'll never see the Part B premium. I mean, it'll be an afterthought. They're going to take it way before you even see it.
Okay. So, do you have to enroll in both Medicare A or B, or is one automatic and the other not? So,
A is automatic,
Okay.
and Part B you have to elect for. It really depends on the situation. If you are not collecting Social Security, it's just, and once you enroll in B, Part A is automatic.
okay.
So you don't only have to enroll for B. You can't have B without A.
Okay.
So once
got
you
it.
enroll in B, you're going to get A automatically
Okay.
because A is free. So they
Perfect.
assume that everyone wants it. Of course, you'd want it if it's free.
Perfect. So you mentioned there's a penalty if somebody doesn't take Medicare at age 65 but takes it later. What is that penalty?
The penalty is 10% per month. 10% per year of the Part B premium. So say the Part B premium is 175, we'll round up.
Sure.
You're going to pay 10% more. So you'll pay an extra $17.50 per year until you take Part B.
Perfect.
So say you're 70 and you've never had Part B, you've never had credible work coverage. You're going to pay, what's 17 times 5? You guys are
Sure, yeah.
You guys are smart. What's that?
17 times 5, 35. I think
80.
85. Yeah.
So you're going to pay $85 more for Part B than the person who got on it right away. And that penalty is forever. That penalty does not go away. So even if you are quite, Jeff, do I have credible coverage? I'm still going to work. I'm turning 65. You just call me and I'll tell you you're good to go or you need to go on Medicare. You don't want that penalty because it does not go away. The same thing with the drug plan. If you are eligible for a drug plan at 65, everyone is, and you don't have credible drug plan coverage through your employer, it's a 1% penalty per month until you get a drug plan on the average drug plan cost. So an average drug plan is $25 a month, we'll say. You're going to get a 1% penalty until you get a drug plan if you don't have credible coverage. So you get a penalty on that as well, which is also forever. So you really want to make sure that you speak to a professional so you don't have those penalties.
Perfect. So you mentioned earlier, we talked about the IRMA, the income-based increase. If somebody does have a one-time income event, how long do the higher premiums last?
It's a great question. This is what we're going through. With my client right now, Kathy. She sold her mother's home and had a $300,000 taxable income event, and she got killed for 1 year. It's every 2 years they evaluate, or every 2 years back they evaluate it. Okay. So for 1 year, basically.
Okay, got
so
it.
for 1 year, you'd pay more for Part B, and then once you do your taxes for the next year, they'll evaluate it, and then you'll be back on track again. But yeah, unfortunately, it's for the year. So you really want to speak to someone like me and your accountant at the same time to see if there's any way around. I'm not an accountant.
Sure. No worries.
To see if there's any way around that situation, maybe putting it in a trust or whatever. I'm not an accountant. But
Yeah,
sure. I'm sure there's ways around it.
Yep, no worries. So if you sorry, let's look through here. Can Medicare be used to cover long-term care expenses?
Medicare does not cover long-term care at all. It's a question we get all the time. It covers skilled nursing, like we talked about. You get, let's go back here. Let's go back to, so skilled nursing, you get if you have a supplement like the G plan we talked about, you have 100 days of free skilled nursing.
Okay.
So say you're in the hospital, after that, you got to go get some rehab and all this good stuff. You get 100 days for free with a supplement.
Okay.
After that, it's considered long-term care, and Medicare does not cover long-term care.
Okay.
If you're young enough and healthy enough, there are a lot of long-term care policies out there that I can help you find that will cover a long-term care facilities and give you a certain amount of money per day to pay for a private nursing and all that good stuff. But Medicare does not cover long-term care, unfortunately.
Okay. No problem. Thank you. And then the last thing that I see here, somebody just hit into the Q&A asking if the slides will be provided.
Yeah, I'll email. Dawn has them all.
Okay.
She has the whole presentation on PowerPoint. She could. I don't know if she's not in here, is she?
She is with us. Yeah.
Okay. Dawn, you have everything, correct?
I do have everything, and we're going to be getting this all approved through our compliance department so we can send out the whole video.
Yep, perfect. Yes, all the slides Dawn has. She can, whatever you can send it out to anyone who needs it, and I'd be happy to answer any more questions. I see that. Do you have a sign up for Part A at 65, even though you're working, have eligible medical coverage from the employer? So that's the last one you saw, Chris, in the Q&A.
Yeah, you can. Sorry, yeah.
Yeah, so you don't have to, as long it's called TEFRA. They're called TEFRA rule, TEFRA. As long as there's 20 eligible employees enrolled on your employer coverage, you do not have to sign up for Medicare. That is considered credible. If you work for a huge company, you don't have to do anything. Keep working, keep that credible work coverage, and then I'll help you transition as you retire. But if there's less than 20 employees, you have to, it's called the TEFRA rules, you have to sign up.
Okay.
Or you'll get the penalty.
Perfect. And then I have one last one offline, and then I'll turn it over. So now that the open enrollment period is happening, what can you do now that you wouldn't be able to do at other times of the year?
Change your drug plan. That's
Okay.
number one. You cannot change your drug plan unless, except for in this time period. You're stuck with your drug plan. Once December 8th hits, you're stuck with your drug plan all through 2024. And then the Medicare Advantage plan. You cannot change your Medicare Advantage plan unless we're in this time period. If you don't change it by December 7th, you're stuck with it for the entirety of 2024. There are specific, they're called specialty enrollment periods, SEPs. There are very specific cases where you can change, but again, I'd have to speak to the person and see what their situation is.
All right. Chris, did you have any other questions?
No questions, but a huge thank you to Jeff. I do appreciate your knowledge, sharing it, and your time. And just sort of an announcement for those that are still left on the webinar here. We do these 4 times a year. We do them for basic educational purposes for our clients, friends, associates. So if you thought tonight's webinar or town hall, we like to call them, we're a little bit laid back here. So some people saw me drinking tea during the entire presentation. So it's not so formal where we got to come in a suit and tie. Come in your fuzzy slippers, right? Tune in. If you want some information, if you thought it was useful tonight, pass along the information for our next one to a friend of yours, to a colleague, someone who might have some questions about, our next topic. We do like to post our next topics ahead of time, so you'll know what that is well ahead of time, and have them join us too. We do record them. We do provide slides and recordings afterwards as well. But there's nothing like being on here live, getting the interaction, getting the questions back and forth, getting your questions answered. So we encourage people to reach out and join us. Bring your friends, bring your family, bring your colleagues. Tell them how informational these things are and spread the word a bit.
Perfect. Thanks, Chris. Jim, Mark, do either of you have anything that you want to add?
More as well, thank you, Jeff. First of all, and then secondly, more as a logistics thing. For those who had requested copies of the slides or want a recording of this, this is, I guess, more for Chris and Dawn. I know when people sign in, sometimes we only have a first name or, we don't know, we don't necessarily know who you are. So if you want that, make sure you reach out to whoever your advisor is so we can make sure to get that stuff to you.
Good point, Mark. Real good point. Yeah, most of the time we can figure out who you are, but there's usually 10% or so that you're that anonymous. We can't figure you out. So, yeah, make it easy on us, please.
Yep. Jim, anything?
No, just thank Jeff for the presentation. And secondly, I think it's important for people to know that they can have these plans reviewed.
Yep.
He pointed that out earlier, and I believe a lot of folks think once they sign up, they're kind of set and done. So that was a good point he made, that these plans should be reviewed either annually or every other year. So good point.
Perfect. Well, to cap on, to add to everything that everyone already said, Jeff, we really appreciate your time tonight. And
Absolutely,
one
my
last
pleasure.
time, do you want to just remind everyone how to get in contact with you?
Yeah, so the best way is honestly my email or my cell phone number. If they can still see the screen,
Yep.
my cell phone number is 774-230-5695. You can text me, call me, and then probably the best way is email. And I'll answer within, I'm usually within 10 hours, if that. I'll answer your email and we'll get you squared away and answer any questions you have. And like I said, there's no pressure selling. It's just doing what's best specifically for you. And I really enjoy doing this. And I really thank you guys for having me on. Jim and Mark have been really good promoters of mine for a long time. I've known Jim forever. I just met Mark a couple years ago. I helped his mom with Medicare, and they've been super, super supportive. And for me being a kind of young, I guess, guy in this industry, it means a lot to have guys who support me like that. So I really appreciate the time, guys. Thank you so much for having me. It was all my pleasure.
Awesome. Well, thank you so much, Jeff. We really appreciate it. And we appreciate everyone who came out tonight. Like I said, please just email us if you have any questions, if you need any contact information, or if you'd like the slide deck, let us know. And if not, we will sign off here. Thank you guys so much, and we'll talk to you all soon.
Take care. Thank you.
Bye. Thanks, Jeff.